This is Dr. Justina Agnieszka Chevalier from Jackson's House historic site. This is the historic courthouse. Sometimes I wonder, after I've been rejected by American Lawyers Association when it comes to representation of abused groups of actually pressure that are pushed into committing minor misdemeanors and then accused of crimes to protect under the bright daylight crimes on a larger scale, and kind of these guys that sometimes I wonder how much of a pride is left in persons living around once the awareness that is undeniable of persons doing that consciously or just simply lacking courage reminds. I don't have much of a pride left when it comes to my country of origins, nor do I have much pride of United States. I basically have no pride of any country or establishment. That is a very good topic. That topic is, and I entitled it that way, not covered yet. I've covered it once in a lecture given on Twitter, and it treats many mistaken articles on torture. On torture that is actually meant to retrieve information or put pressure on persons to pursue a relationship or to end relationship, be it of the nature of a family or a romantic relationship, including drugging up damage done to brain and assaults and prolonged torture, including confusion associated with who and how organized it. That is what the topic is. I include that topic in a book, Getting Married, because it is very relevant to, and don't get me wrong, many persons, for instance, think that a pain threshold, that is something that we can ramp up to, and that is false. So that because prior chapter was medicine on regeneration, aging and death, that topic I've covered already sufficiently, but the topic of pain is very common in medicine and very common in many cultures and subgroups that use hazing, torture and or other techniques to distort reality or to reduce memories. And so I will cover it in a different book. That Twitter was closed as usual because the internet is corrupted and impossible to report to FBI or sue in United States as well as in Poland. I have not tried any countries apart from this, but for Africa. And I also tried to gather my data from others. So France is the same, for example, and Mexico as well, for example, finding legal representation when that does not involve personal interest of diverse immoral content is not possible, be it because of cowardness or because of an actual ulterior motive and in ignorance, because that's derived from ignorance. Usually all lose on it. So pain is an interesting topic in medicine. I just would like to address it with pain threshold. If we take what I denominated memory reference in a person's life from conception to current moment, pain threshold actually by exposure does not increase in tolerance of a person, each of us and animals as well, but decreases. It means that with age, and it follows the same rule as psychological trauma, because pain can be not visible. The mental pain is pain that is actually physical, and with time, if ignored for long enough, leads to changes in body, because it is always, when that is happening, an external, non-in function of control, because control of a person rationally, we can reject or accept things by aversion. When I feel aversion, I cannot smoke. When I have pleasure from smoking, I can smoke. Whereas when an insult is from outside and is beyond control, that leads with time to cellular changes. So first is manifested as psychological distress or pain. And so that topic is very interesting because some mistake what is conditioning to perform an activity. What is a conditioning? Conditioning is pain that, and it is not that I created the duality as opposed to terms to denominate some things. It just exists. It is suffering that is contempted upon, or suffering that is cause of a lack of tolerance, and that does not increase. And so that suffering that is cause of lack of tolerance, meaning unbearable pain, because pain may be bearable, which is then person does not pursue sedatives. Unbearable pain has two components. First one is the pain, so perception of pain, and second one is how well I can cope with that pain. And so the attitude, the second scale of that, is a scale that gives us a prediction on how close a person is from wishing to be dead or wishing to pursue a very vigorous action to reduce that pain. So an example of that is, for example, for once, two conditions: a pain during exercise, muscle pain, and pain when that actually stops and is muscle recovery. Normal pain, it is something that, okay, even if I cannot, because I was a rower for some time, so I have quite good comparison, that even if I cannot climb stairs, for instance, after a strenuous training, I feel a sense of achievement, because I know that my muscles are actually going to be bigger, and the next time I go and train, those muscles will not break apart, but will continue growing, and I will feel that's conditioning. I will feel less and less what's the word, predisposed to experiencing the same discomfort with the same level of injuries. Now, the second example of pain is pain inflicted by others or by an accident, and so that type of a pain is pain that I then do not enjoy. I mean, it is painful, but I know that if I ignore remaining in the same circumstances, that will lead to cellular damage or death or body loss. And that is sometimes it's okay to add a third type of pain that is inflicted rationally on self, and that is, for instance, by dosing pain. So that is often presented in persons who indulge in self-injuries to wake up or to do many other things, or to test, for instance, how awake the receptors are, because persons feel numb, especially during persistent activity that is of a different type than interaction with body, especially cognitive intellectual. Prolonged surgeons often, for instance, prolong hours of stitching or doing something that is numbing, that one loses touch with own body. And so those are inflicted upon tolerance, the same as smoking. So a person actually inflicts an injury, and when aversion, strong aversion that a person is unable to continue appears, a person stops, and then regeneration appears. And so in the same way, that is similar to training. Now, in the middle, the pain related with torture or exposure to environmental factors that are beyond our control. Beyond of my control, for instance, is obtention of a valid identity card that is not a green card, that I require prerequisites in a bank to reopen my bank account. That's beyond my control. I tried many sources, it's beyond my control. That causes me to be forced to walking, for instance. and it is beyond my control. So see, thank God I actually have mechanism of knowing when I have to stop and I have to rest, but the situation I am pushed into is beyond my control, and it is illegal. You see, it is illegal in the United States and it is illegal in other countries, but common in commonly done in females post-divorce. My mother, who was a lawyer, she's probably dead now. She told me that she tried to divorce, being a lawyer, a licensed one, so basically having network and connection, well functioning one, and having also right to pursue own divorce. She was unable to divorce my father despite him not wanting to be with her, and physical violence whenever she was in certain conditions preventing him from what he wanted and perceived as relationships related to work, but he couldn't, as it is common, make a distinction in officials. And so you see, pain that is not bearable. So pain, for instance, if somebody came and took my hand and started injecting in it needles to cause pain, and or with an intention to heal but without any training, persons impose harm and kill tissues and kill persons, despite person manifesting proximity to death, because pain manifests I am going to die. So that is iatrogenia in all medical fields, common, very common to mention, and unfortunately, because laws are occupied by lawyers who do not practice law, it is not possible yet to pursue. Apart from I don't know anyone else who does it. And so that takes then a group of pressure and also association with certain things of what's the word? Apart from information spreading, things that can be done to impose things on persons that have an office because they were elected. You see, the same is with licenses. And so I want to introduce first the concept of, again, torture. So if somebody took my hand and burned me, or for instance administered needles, shocks and drugs against my will for 2 to 3 weeks, right, that as a result, as an expectation, with intermittent sessions of trying to deny, for example, things like medical license, or deny, for example, a love or emotions towards certain persons that I used to, or I knew that loved me. You see, if somebody did that on a persistent basis, and we all are like that, it is the same as infliction of any other pain. So for instance, somebody would take a lighter, it needs to be another person, not I, you see, because I cannot do it to myself, and started burning me. I would not be able to, when the aversion appears, which is a signal of there will be damage to your tissue, to take that hand away or inform a person don't do it, you see. And that is when the person who would keep on going is a torturer. And so if a person would keep on going, well, that would result of loss of skin, epidermis, dermis, and then all the underlying deeper tissues, including the fascias and the muscles, etc., and the bones. And I would lose, for instance, my hand. And so that is torture. And torture, if that is done in order to provoke a behavior, punish for behavior, or obtain testimony, as well as discourage, for instance, love or loyalty towards persons, it does not bring that effect unless the person who does it is the person who is the one who is in question. So for instance, when that is a person that I thought I loved, a husband who would torture me, that didn't happen, but it could, or I would know that, knowing that I will be tortured, he ordered it, that did happen, then I would not be able to come back to that person and love that person, knowing that that person does not love me. And if so, that is often insinuated. If that is not insinuated but actually evoked, and it is possible to figure out, not only using detectives, but possible to figure out, the person who tortures is, for instance, an untrained in psychology and psychiatry torturer from the office, like prosecutor or a detective. So that person will obtain always a confession that is what that person who tortures wishes to hear. So from truth to the opposite, the person will not know who is torturing, what the other one is saying, which one is veracious. That is the pain, and there is also no conditioning to it. Next time person will respond to a real version faster.